Okay, we've all been there, right? That pounding headache, that creeping fever. You stumble to the medicine cabinet and you're faced with that classic choice: acetaminophen or ibuprofen. Most of us, we just grab one, don't even think about it. But what if I told you that behind those two tiny pills are two completely different, almost like secret missions happening inside your body? So here's what we're going to do. We're going to really dig into this. First, we'll meet our two main players. Then, we'll follow ibuprofen on its body-wide mission and see how totally different that is from acetaminophen's, well, its secret agent work inside the brain. And you know what? Understanding their strategies is going to show us exactly why they have such different side effects. And by the end, hopefully you'll be able to make a much smarter choice. All right, let's dive right in. Time to meet our two heroes, the painkillers we all know and, let's be honest, probably couldn't live without. I mean, it's a question we've all asked ourselves, standing there with that little bottle in our hand. And the thing is, the right answer? Well, it comes down to some really fascinating and surprisingly different biology. You know, at first glance, they seem pretty similar. On one hand, you've got acetaminophen. You know it as Tylenol, great for pain and fever. Then you have ibuprofen. Think Advil or Motrin. It does pain and fever too, but it has this third superpower. It crushes inflammation. And that right there, that's our first big clue. See, ibuprofen is what's called an NSAID, a non-steroidal anti-inflammatory drug. But acetaminophen? It's kind of in a league of its own. Okay, so let's follow that first path. We're going to track ibuprofen's journey. And it's basically like a full frontal assault on pain, happening all over your entire body. So to get how ibuprofen works, we first have to meet the villain of our story. They're called prostaglandins. Just think of them as your body's little chemical alarm bells. When you get hurt, your cells crank these things out to basically scream, "Hey, something is wrong over here." And that scream, that's what you feel as pain and heat and swelling. And the assembly line for these little alarms is actually pretty straightforward. Step 1, a cell gets damaged. It spits out this raw material, arachidonic acid. Then, these enzymes called COX-1 and COX-2, picture them like tiny factories. They grab that raw material and turn it into those prostaglandins. And just like that, the alarm goes off. Okay, so here comes ibuprofen's strategy, and it is pure brute force. It just marches in and physically blocks the front door to both the COX-1 and COX-2 factories. No subtlety here. It doesn't pick and choose, it just shuts down the whole operation everywhere in your body. So if the factory door is blocked, the raw material can't get in, which means no prostaglandins can come out. And the result? The alarms go silent. No pain, no fever, no inflammation. It's simple and it is very effective. But now, let's talk about a completely different approach. Acetaminophen's path isn't a brute force attack at all. No, this is more like a highly specialized spy mission that goes straight for central command. And this is where it gets really interesting, because here's the puzzle. Acetaminophen is actually terrible at fighting inflammation out in your body. So if it's not shutting down those factories at, say, your sprained ankle, then how in the world is it stopping the pain? The answer is, it's not working there. It's working somewhere else completely. This is the secret agent's journey. First, the pill you swallow heads to the liver. It's basically a disguise. The liver metabolizes it, changing it into a new compound. Think of this as our agent getting its new identity. This new compound travels through the bloodstream and has the top secret clearance to get past the blood-brain barrier, which is like the most secure checkpoint in your whole body. But wait, the mission's not done. Once it's inside the brain, another enzyme converts it again into the real active agent, a molecule called AM404. And it's this final form, AM404, that goes to work on receptors in your central nervous system, basically just turning down the volume on pain and fever. So here's the key takeaway from all that. When you take acetaminophen, you're actually taking something called a prodrug. The pill itself doesn't do much. Your body, your liver, and your brain, they have to do the work. They have to build the real hero molecule, AM404, right on site, deep inside your central nervous system. Okay, so you've got the body-wide blocker versus the brain-based secret agent. Let's put these two strategies side by side and see just how different they really are. I mean, the difference is just night and day, right? Ibuprofen acts systemically. That means everywhere in the body, blocking those COX factories directly. Acetaminophen, though, its action is central. It's focused just on the brain and spinal cord, and that explains everything. It's why ibuprofen is a powerhouse against inflammation, while acetaminophen barely touches it. And maybe the biggest difference? With ibuprofen, the pill you swallow is the thing doing the work. With acetaminophen, it's all about that secret agent it creates, AM404. All right, now we have to talk about the consequences, because the way a drug works, that also determines the way it can cause harm. Each of these unique strategies comes with its own unique set of risks. You know, every mission runs the risk of collateral damage, and it's no different for these painkillers. In fact, the very thing that makes them so good at their jobs is also what can make them dangerous. And this is where those different strategies really matter. Remember ibuprofen's body-wide shutdown? Well, it turns out some of those COX-1 factories it closes are actually making prostaglandins that protect your stomach lining. So when you block them, you risk ulcers and bleeding. It can also mess with blood flow to your kidneys and even increase the risk of heart attack and stroke. Now, acetaminophen, it totally leaves your stomach alone, but because its whole mission kicks off in the liver is the organ that takes the biggest hit, especially if you take too much. And that risk to the liver is no joke. It's incredibly serious. I mean, check out this quote. It says, acetaminophen overdose is the #1 cause of acute liver failure in the Northern Hemisphere. What happens is, at high doses, your liver just gets overwhelmed. It can't keep up. And this really toxic byproduct called NAPQ starts to build up and just destroys liver cells. This is exactly why the dose on the bottle is not a suggestion. It is the absolute max you should ever take, period. So, to sum up the ibuprofen side of things, all its risks come from that body-wide shutdown. By blocking the good prostaglandins along with the bad ones, it can leave your stomach vulnerable to acid, interfere with crucial blood flow in your kidneys, and over time, it can contribute to some really serious heart problems. Okay, so let's wrap this all up. Understanding these two completely different missions, it's not just for fun, it's not just trivia, it's really the key to using these medicines safely and effectively. So if you remember anything, remember this. Think of acetaminophen as the brain's secret agent. It's precise, it's targeted, and its main risk is to its home base, the liver. On the other side, you've got ibuprofen, the systemic roadblock. It's powerful, it's body-wide, but that means potential collateral damage to your stomach, your kidneys, and your heart. The bottom line is, they are not interchangeable. They are two totally different tools, and each one comes with its own unique instruction manual and its own safety warnings. So, now that you know their secret missions, the real question is, will you look at your medicine cabinet a little differently the next time pain strikes?